Good morning, dear friends. So let's discuss a new topic today. Before that, I'll discuss a case with you. You need to find the diagnosis for me, or else you can guess. A 65-year-old gentleman presents to the OPD with the symptoms of cough and breathlessness on exertion, which lasted for the last 6 months. And while taking the history, the patient is a chronic smoker. He started smoking since his age of 16. And while observing the patient has pursed lip breathing, and the patient is using his accessory muscles for respiration, and there is intercostal muscle retraction as well. So we have ordered for X-ray, and the X-ray shows that there is hyperinflation of the lungs. And while coughing, sometimes the patient attains a tripod position. So can you guess the diagnosis? Yes, you guessed it right. It is COPD. So the topic of discussion today is COPD, chronic obstructive pulmonary disorder. So let's define COPD. First, let's make it very simple. Let's split the words. Chronic obstructive pulmonary disorder. So what is chronic? In medical terms, or in medicine, we say chronic is something which lasted for a long time. So some disease which has been persisted for a long time, so that is chronic. Obstructive means something which causes an obstruction or something which blocks the flow of air. Pulmonary means something which is pertain to the lungs, and D for disorder. So chronic obstructive pulmonary disorder is something which obstructs the airflow or which causes narrowing of the airflow and which is persistent for a long time. So let's define it. So chronic obstructive pulmonary disorder is a common progressive lung disease characterized by persistent respiratory symptoms and airflow limitation. So what we have to note here is it is a progressive lung disease. It is characterized by persistent respiratory symptoms and airflow limitation. So I hope you understood the definition. So let's move on to the types of COPD. So there are two types of COPD, or two diseases which comes under the classification of COPD. First one is chronic bronchitis and the second one is emphysema. So let's move into a gist of all these diseases. So chronic bronchitis, as the word suggests, it is the inflammation of the bronchioles and it's persisted for a long time. So characterized by inflammation of the bronchial tubules, results in excessive mucus production and lead to chronic productive cough. So the inflammation causes a lot of mucus production and which persisted for a long time. And what is emphysema? Involves the damage of the alveoli. So in chronic bronchitis we discussed about the bronchial tubules, and in emphysema we are talking about the alveoli. The main difference is in emphysema the air got traps inside the alveoli because the alveoli lost its elasticity. So the alveoli will not be able to push the air back, so it loses its elasticity and the air gets trapped, leading to difficulty in exhaling and shortness of breath. So these are the two types of COPD. So you can ask me why asthma is not coming under COPD. Asthma also sometimes shows the same symptoms. The reason is asthma is a reversible change, whereas emphysema and chronic bronchitis is irreversible change. So let's see what are the reasons, or what is the pathology or ethiopathology of COPD. So pathophysiology of COPD is airway inflammation, airway remodeling, alveolar damage and airflow limitation. Let's discuss the clinical features of COPD. Before that, let's go into the etiology. 90% of all cases are due to smoking. Some cases, less than 10% is due to alpha-1 antitrypsin deficiency, which is a genetic disorder which I'm not going into detail about it. So pathophysiology we have discussed. Let's move on to the clinical features of COPD. So it's chronic cough, shortness of breath, wheezing on auscultation, or we can hear wheezing as well. Sometimes it leads to frequent respiratory infections. Fatigue, the patient will be always tired. Cyanosis, you all know what is cyanosis is, right? It's a bluish discoloration of the lips and fingertips due to low oxygen levels. So let's move on to the clinical findings. We have discussed the clinical features. Let's move on to the clinical findings of COPD. There will be barrel-shaped chest because of the, as I had said in case of emphysema, the air goes inside but the air won't go outside because of the lack of elasticity. So there will be barrel chest or hyperinflation of the lungs. Then I said initially in the clinical presentation that the patient had usage of accessory muscles. Then on auscultation, sometimes there will be decreased sound and sometimes there will be rails or wrong guys, and there's a prolonged aspiration phase because patient puts a lot of effort to move the air out of his lungs. Then cyanosis, which is seen in the advanced cases, and clubbing. So I'll give you an assignment today. You have to find out what is Shamroth's sign, SHAMROTHS, Shamroth's sign, and you need to find out what is PAK ear, PSEKYEAR. So you need to write it in less than 50 words.